The last Chief Medical Officer, Liam Donaldson, was pushing very much about physical activity's effect on depression and anxiety. And he very often quoted the fact that the effect on depression is exactly the same as medication. So if one can become more active, you can actually reduce or prevent depression in a very similar way that if you're taking antidepressants. And it's true, we now know that there is a major effect on depression. The difficulty is getting patients who've got depression to become more active, because often they need to have that confidence, they need to have that inertia to get them going, and that's often lacking if they've got severe depression. So NICE guidance clearly states that patients who've got depression actually need to have physical activity as part of their treatment, often in groups if that suits the patient, and up to about 14 weeks. But there's clear guidelines showing that it can be as effective as medication. There have been many studies showing that there is an association between being active and a reduction in depression. A lot of the problems about this, of course, is that patients who are already very well and very active in themselves tend not to be depressed in the first place. So there could be this association, but increasingly now the evidence is showing that there is a causation as well. So having a cumulative physical activity through your life can actually prevent depression in the long term. But patients who are at high risk of depression, who've already had depression, physical activity can also prevent the recurrence of depression. Now, there's some studies that show that in addition to medication, it may not make much difference. A study done in Exeter that showed that the addition of physical activity made very little difference to patients who are already taking medication. But what we can say is that patients who have no medication do better with physical activity than if they have nothing at all. So there is an evidence base on prevention, up to about 30% reduction in depression incidence by becoming physically active. Like in every other condition, the recommendation for physical activity is 150 minutes. So it's very much the guidance from the CMOs. Vigorous activity may have a bigger effect on depression, so that's an important part to play. And social activities as well may be another element. And in green spaces as well, there's even more evidence to show that the natural spaces and natural greenery around can be an antidepressant, as well as the exercise, as well as the social aspect. So putting all three together, like the health walk schemes or like working in outdoors, can make a big difference on patients who've got depression or preventing depression. For patients who've got anxiety or chronic anxiety, they may be undergoing CBT, but physical activity should all be part of the treatment. It may not be a replacement of some of the psychological treatments or even some of the medication, but it should always be there part of that treatment, and it's been shown to have an effect. We now know that anxiety has got an inflammatory component to it in the brain, and therefore with the anti-inflammatory effect of physical activity, this may explain why activity can actually reduce the anxiety in patients. But the evidence shows it really should be part of a package rather than just a single component of treatment. There's been a lot of increasing evidence to show that physical activity can prevent dementia, and it's a lifelong physical activity, seems to have an effect more so than even people who kind of using their brains for different puzzles and things like that. Evidence showing that actually it's physical activity that may be the most potent protector for dementia. This was initially association, it may be stronger now, and it's about a 40% reduction risk of developing dementia in patients who've had a lifelong history of being active. For patients with dementia, physical activity can actually help their functional capacity, allow them to become a bit more independent as well, because very often they'll be sitting very sedentary. There's an additional benefit if they're outdoors, an additional benefit to that if they're outdoors in a natural and green environment where the physical activity can be done in a safe environment, but there's the connection with nature helps to reduce the aggression and the anxiety in these patients. So combining physical activity and outdoors for patients with dementia can be very therapeutic and beneficial.